Do you have a scar that just won't fade, and are you wondering if there's anything that can actually help? Hi everyone, I'm Dr. Aleksandra Brown. I'm a board certified dermatologist and I'm here to help. Welcome back to my channel, or welcome to my channel if this is your first time here. The truth is, scars don't disappear overnight and some may never fully go away, but there are dermatologist approved treatments that can significantly improve their appearance. So if you're into derm approved skincare and beauty tips, make sure you like, comment, and subscribe for more. Before jumping into treatments, it's important to understand why scars look different and why they happen. There are 4 different types of scars. Some are what I would consider true scars, and others are more pigmentation disorders that you might call scars, but we're going to go through how they happen, why they happen, and what you can do to treat each one of those. First type are the flat and dark scars. This is like hyperpigmentation. You might call it a scar, but to me this is really just a hyperpigmentation. These are leftover marks from inflammation, really common after acne, cuts, or burns. Then there are red scars, or post-inflammatory erythema, or PIE. These are often seen after things like acne or minor irritation, like you've used a chemical on your face that really caused burning and itching, and now you have a red mark there. The cause of these are the dilated blood vessels underneath the skin. And then there are 2 types of what I would consider actual scars. Some are indented and others are elevated. The indented scars are also called atrophic scars. These include things like ice pick, rolling, and box scars. These are caused by collagen breakdown underneath the superficial layer of the skin, which is why you see that actual change in the texture of the skin. And the last category here are the raised scars. This is like a typical scar. In this category, we have hypertrophic scars and keloid scars. The difference between these two is if you had a surgery scar that was, let's say, this long, hypertrophic scar would be along the length of the scar and it would be within the confines of the scar. It would be just elevation where the scar is. Keloid is a scar that's outside of the confines of the original scar. So if it went on the outside, whether out or lengthwise, that would be a keloid. These are results of overactive healing. They're more common in darker skin tones in certain areas like ears, chest, and shoulders. Now that you understand that, let's talk about best treatment options for really fresh scars, or let's talk about treatment options that you can do at home. All of the at-home treatments are best on really fresh scars. So if you have something that is years or even decades old, that is not likely to improve no matter what you do at home. Some of the in-office treatments may help improve those, but scars are best treated if you start early. The at-home treatments are going to work best on really fresh scar, and consistency is going to be the key. The top ingredient for at-home that you want to look for is hands down silicone. Now it doesn't matter what brand you get. We'll talk about a brand that I will often recommend, but silicone is the active ingredient. So if you find a scar cream that you think might work for you, make sure you flip to the back of the bottle and check the active ingredients. It should have silicone. Silicone scar treatments come in sheets and gels. It can be a sheet of silicone that you can cut and apply to your scar, or it can be like a gel or cream that you apply. It's best for raised scars, surgical scars, any type of injury. These have to be healed. You never want to apply silicone to like an open wound, but they have to be pretty fresh scars. So you would want to start silicone as soon as your sutures are removed, if this is a surgical scar, or as soon as your skin has healed over, if it's from a scrape or a burn. And healed over meaning there's no opening on there whatsoever. Silicone helps flatten, soften, and fade scars by improving the hydration and helping regulate the collagen production. An example of this is the scar away sheets. These can be found in your local drugstores. Next best treatment at home for your scars is Vaseline or healing ointments, something petrolatum based. If you want something more natural, you can consider Medihoney in this category. These are best for open wounds, so before you need that silicone. If you just had a scrape or you have an open wound to cut, make sure you clean it really well with just soap and water and apply an occlusive like Vaseline or healing ointment. These help keep the wound moist, so they will allow it to heal from the bottom up. Keeping the wounds hydrated is important to minimize the scarring. It might appear that they take longer to heal if you're applying Vaseline, and you might say it's wet all the time, it's just not healing, I need to let it dry out. Please don't let it dry out. Do not let it dry out, because when you let an open wound dry out, it forms a scab. That scab is likely to fall off. When it does, it forms a scar. So you are less likely to scar if you keep the wound nice and hydrated while it's healing. The way you use these occlusives is you apply a really thin layer on open healing skin to help prevent that excess drying and cracking. You want to do this on clean skin. The best way to clean your skin is just plain soap and water. The three things I see patients applying to open wounds all the time, and I always tell them to stop, are alcohol, peroxide, and neosporin. If you have any of these three in the house, you don't need them. The only reason to have peroxide in a house is to get blood or stains out of your clothing. You don't need it on a wound. If you have a dirty wound, you want to use peroxide one time, that's fine, but do not reapply, because that breaks down the new blood vessels and the new healing tissue and slows down the wound healing. And every time you slow down wound healing, you're going to increase risk of scarring. So to clean the open wound properly, soap and water, and then for your occlusive in this category, I recommend things like Aquaphor, CeraVe Healing Ointment, or plain Vaseline. The next treatment for your scarring are retinoids. These are things like retinol over the counter, the tretinoin, the adapalene. These are best for acne scars. They also help fine lines and texture. They work by speeding up the cell turnover, so they gradually improve and fade the texture and discoloration. Some of the examples here are Differin Gel. Active ingredient is adapalene. This also comes from La Roche-Posay in the Effaclar form, and Neutrogena also makes adapalene, and then tretinoin prescription strength. But the most important part of treating your scar is SPF. Once you have a scar, you need to be applying SPF to it every single day for a minimum of 9 months. Why, you might say? UV exposure will darken the scars and slow down the healing, and you can end up from what would have been a pink scar turn into like a skin-colored scar to a permanently discolored brown scar if you don't wear sunscreen every day on it. So wearing a broad-spectrum SPF of at least 30 is non-negotiable when treating your scars. Some examples here are things like Eltam UV Clear, really good for acne-prone skin, so great for face. La Roche-Posay and Thelio's Melted Milk Sunscreen is amazing, feels so nice, goes on really cool. Another thing you can do with your scar is massage it, especially elevated scars. If you've had a surgery, you probably have deep sutures underneath, which can take several months to dissolve. So massaging with firm pressure is important to help break up that scar tissue underneath and break up some of this collagen in the scar tissue. What you want to do is, after your wound is completely healed, or if you had sutures, let the sutures be removed, and maybe even wait a week or two after sutures, and then gently massage the area 1 to 2 minutes per day to help break down that scar tissue. Put pressure on the suture and just firmly massage. Don't push it back and forth or left and right across where the suture line was, because you don't want to break that open. But if you just put firm pressure and then massage it to break up the scar tissue underneath, but not like at the top, that's ideal. I think of scar tissue, or especially hypertrophic elevated surgical scars, I usually tell my patients collagen is like this. It's super tight. Normal skin is like this. Really thick hypertrophic scars and keloids are like this. So when you're massaging it, you're going to loosen that collagen hopefully and soften it a little bit. If you have a scar and you've done all this and it is absolutely not getting any better, there are in-office treatments for really stubborn and severe scars. Laser therapy is one of them. The laser therapy is best on red scars. And by laser therapy, I'm referring to a pulse style laser. This is the gold standard for red scars. It works so well. So whether you have a red scar from a surgery, an injury, or you have post-inflammatory erythema from maybe acne scarring, this will do so well. The scars might look purple, a little bit darker for a few days afterwards, but then your body reabsorbs that pigment that was formed between your post-inflammatory erythema and the laser, and once that's reabsorbed, you're left with glowing skin. Other lasers will target more of the pigment and treat post-inflammatory hyperpigmentation, and there's also lasers like CO2 and Frax that have chromophore for their active agents, so they're going deeper into the skin. Instead of targeting the superficial layers where the blood vessels and your pigment are, it is targeting collagen deeper in the skin, and those lasers are better for acne scars and wrinkles and indented scars. So if you think of your scars as pigmented, whether they're red or brown, you can use more superficial lasers. They tend to have less downtime. Or if your scars are atrophic, meaning indented, like acne scarring, you're going to want something like Fraxel or CO2 laser for those, because they help increase cell turnover, treat the collagen, and help improve the texture of the skin. Microneedling is another treatment in office, and this is probably my go-to and my favorite because it has minimal downtime. It's relatively inexpensive. You can do it with or without PRP. PRP stands for platelet-rich plasma, where we draw your blood in the office, spin it down in a special tube, and then concentrate your platelets in the serum and use that as a gliding agent, and sometimes even inject it into the scars after the microneedling. This is best for indented acne scars and even fine lines. During microneedling, your face is numbed ahead of time, and then these tiny needles in the microneedling device go in and out of your skin. They go deep into that second layer of the skin where the collagen is, and when you injure the collagen, it tends to proliferate. So it will go from normal skin and you're kind of tightening it, almost opposite of what I was talking about earlier. When you do that, if you have indented scar and you're tightening it, those scars are going to appear smaller, and you're going to improve texture, and you're going to improve fine lines and minimize the appearance of those acne scars. Adding the platelet-rich plasma on top is going to boost healing time even more. And personally, from having microneedling with PRP done several times, I find that PRP decreased my healing time. Not that healing time with microneedling is very long. It's probably about 3 to 5 days, but I cut it back by about a day or two. Next in-office treatment that I actually get a lot of questions about are chemical peels. These are okay. They're really the best for like your hyperpigmentation scars like PIH, or maybe even sometimes for PIE, post-inflammatory erythema, maybe some really mild superficial texture issues. But chemical peels don't work amazing for deeper scars. If you have a scar that's deeper or wrinkle that's deeper, the chemical peel has to be so strong for it to penetrate deep down into the second layer of the skin and really make any difference that microneedling really wins on the deeper scars. The chemical peels work by chemically exfoliating the top layer of the skin, so they're going to work really, really well on post-inflammatory hyperpigmentation. Some examples here are glycolic acid, TCA peels, and Jesner peel. Jesner peel is really good. It's a combination of resorcinol, lactic, salicylic, really nice concoction that will help with acne, help with post-inflammatory hyperpigmentation. Glycolic acid does maybe a little bit better job with anti-aging, and then TCA peels are really cherry on top. They're a little bit stronger than both, and some of those, depending on the strength, may need to be performed by a physician rather than an esthetician. And then for really elevated like keloid and hypertrophic scar, the only thing that works for them is really steroid injections. This needs to be done in the office. The corticosteroids will help flatten the raised scars and reduce any sort of itch or discomfort or pain, anything that you had associated with the scar. If your scar is really deep, tethered, like if it's on your face from acne, you smile, when you smile it pulls it down and indents it even more, the best treatment option for those would be subcision followed by filler. Subcision is where a needle is inserted underneath the scar tissue to kind of loosen it from the underlying structures and allow it to come up, and then you put just a little bit of a hyaluronic acid filler underneath to lift that depressed area. Now if you combine this procedure with microneedling on the surface, we're talking home run for acne scarring. Now, the best thing you can do, if you can, with scarring is to prevent them from happening. Because once scar is there, it's going to be there. I often hear things like, can I have this mole removed by a plastic surgeon because I don't want to have a scar? I hate to break it to you. Every time you do something, you're going to have a scar. Whether you're going to see it conversationally or you're going to need a magnifying mirror to see it, that's a different story. And that sometimes depends on the surgeon, but sometimes it's more often than not, it's a combination of surgeon skills and how you heal and how you take care of it. So it takes good taking care of and good genetics. It's not just the surgeon dependent. There's so much you need to be doing at home to make sure that's not very visible. But every time you have something removed, you will have a mark there of some sort. Therefore, preventing the scars, if possible, is the ideal. If you have acne, treat your acne early. Don't pop your pimples because that will lead to scarring, indentation, and as we just talked about, those are hard to treat. If you have a wound, a scab, don't pick it. Apply Vaseline or some other sort of occlusive that you prefer to keep that wound moist and hydrated so it heals from the bottom up with minimal scarring. Keep your wounds covered. Keeping them covered eliminates possibility of infection from the outside sources and bacteria. Also allows it to stay hydrated so it will heal from the bottom up with minimal scarring. Use SPF daily. Once it's completely healed on top, SPF is the most important thing and really the simplest thing you can do. I hope this is helpful. I hope it helps you take care of your scar if you're at home, if this scar is early. Scars take time to improve, but with the right treatment, you can see some results. And if you're struggling with scars, let me know in the comments what has or hasn't worked for you. If you found these tips helpful, don't forget to subscribe and like this channel. Also find me on Instagram and TikTok at Dr. Aleksandra Brown. Thanks for watching. I'll see you next time.